Hi everyone, welcome back to my channel. This is Felicia. Again, for those who don't know me or who haven't subscribed to my channel, I'm a licensed professional counselor in the state of Arizona. I do have a master's degree in counseling and I am a trauma therapist. I've been doing trauma therapy for about 10 years. That is what I specialized in graduate school from the get-go. And I have subspecialties in domestic violence and sexual abuse. So that is what I spend most of my time in practice doing. And I just wanted to go over the different types of mental health professionals. I know that there's a lot of confusion sometimes about what are the different types of mental health professionals and what do these particular professionals do. So I did make a grid here and just kind of want to go over some of these. So the ones who only need a master's degree in order to provide services or to become licensed would be counselors or professional counselors such as myself. Usually the license for that would be licensed professional counselor or licensed professional clinical counselor in different states. And then we have social workers. Social workers have a Master of Social Work. You'll see that designated by MSW after their name. And social workers, they have the most versatility in their training. They can be trained to do administrative tasks and run nonprofits. They can be trained to do medical social work, working in hospitals, doing discharge planning, and they can also do clinical social work, which would give them the license to be a mental health professional. These are usually called licensed clinical social workers or licensed independent social workers, depending upon the state. Then you have marriage and family therapists. These individuals have degrees specifically in marriage and family therapy, and that is really all they can do. They can only work with couples and families. So their practice area is very narrow, and their licensure, what they can practice under their license, is also much more narrowed than a counselor or social worker. And then on the medical side of things, nurse practitioners only also have to have a master's degree. Now, some of them do have doctorates, as do some of these individuals as well, but they only need a master's degree in order to practice. So these would be your psychiatric mental health nurse practitioners, and then your psychiatric physician assistants. So physician assistants, aka PAs, also only need a master's degree. Moving on to your doctoral degrees. These would be your psychologist level. So in order to be licensed as a psychologist per the American Psychological Association, you do have to have a doctoral degree in some sort of psychology field that actually meets the criteria. So this would usually be clinical psychologist, counseling psychologist, and some school psychologists. Their curriculum may meet the requirements to become licensed in their state. Now, both master and doctoral level professionals are able to assess, diagnose, and treat. That's what we do. So, like the difference between a counselor and a psychologist would be that psychologists have more training in psychological testing and evaluations. So counselors, we get trained in conducting assessments that are biopsychosocial assessments, clinical mental health assessments, using screening questionnaires, symptom checklists, and some programs do have more objective testing instruments that we can be trained on. I was trained on a few specific objective measures to assess for trauma specifically. But the psychologist would have much more training with regards to that. That's why their program is longer, because they do get more training and education and experience in actual testing and evaluations. All of these professionals diagnose. So if there's any confusion about that, I know sometimes people will think, well, I want to see a psychologist. I don't want to see a therapist because I want someone who can diagnose. Well, we all do that. If you're wanting testing, however, that is a different story. And testing can give a much more objective diagnosis for you that is quantified with lots of data points, etc. So that is certainly helpful, especially in forensic cases, etc. But all mental health professionals diagnose. That is literally what we spend our time in graduate school getting trained on: assessing people, diagnosing people accurately, and doing differential diagnosis. So we should always be doing differential diagnoses, meaning ruling things out. Like maybe somebody shows up with a cluster of symptoms, and those symptoms overlap with different diagnoses, and we have to start asking more questions and going through more history and reviewing collateral information in order to figure out, okay, which of these fits, if any. Sometimes someone doesn't meet criteria for a specific diagnosis. They just have a lot of different symptoms. Okay, and then the other type of doctoral would be an actual psychiatrist. Sometimes people will get psychologist and psychiatrist confused. So a psychiatrist is a medical doctor or a doctor of osteopathy. These are people who do complete medical school and residencies, etc. This is a lot of education right here in order to be a practicing psychiatrist. They may have done 10 to 12 years of school and postgraduate training. Now, psychiatrists are medical professionals. These are the ones who prescribe, as are nurse practitioners and physician assistants. Counselors, social workers, marriage and family therapists, and psychologists do not prescribe. There are some states who have psychologists who give them prescription privileges because they serve a more rural community, etc. But in general, psychologists don't prescribe. You do have to go to medical school or NPPA school for that. Let's see if there are any other differences between these. So psychiatrists do not typically do testing or psychotherapy. They do pharmacotherapy typically. They also utilize a lot of the same screenings that, say, I would as a professional counselor. But generally speaking, they don't have the extensive training in testing and evaluations that a psychologist would. Sometimes they do, especially depending upon their residency or fellowship, etc. They may, but in general, that's not covered in their medical education, nor is psychotherapy. Some psychiatrists do practice psychotherapy. They may be strictly CBT based. Some of them are psychoanalysts. So they may have had that training, but in general, psychiatrists prescribe medications. They'll check in with you. They'll certainly talk to you, but they generally do what's called medication management and symptom management. So the ones who provide psychotherapy, aka therapists. So if you hear the term therapist, that is someone who provides professional psychotherapy services. And that would be a counselor, social worker, marriage and family therapist, and any type of licensed psychologist provides therapy, psychotherapy. And again, that is what we spend so much time getting trained on, is learning how to assess, diagnose, and treat people using different therapeutic models, theoretical orientations, etc. Okay, so I hope that this has been helpful for some of you and that it helps to explain a lot of different things. If you do have questions, feel free to reach out to me. But I hope that this provides information for you that maybe you didn't otherwise know. You can take a screenshot of this if you'd like, if it's helpful. You can also email me with any questions, but these can also, you can just look these up online if you're interested in knowing the difference. But all of us are therapists, essentially. Those of us who are licensed to practice in psychotherapy, we are all therapists. So I hope that this has been informational for you, and I hope that everyone had a safe holiday weekend, and I will see you all again in my next video. Thanks so much. Bye.